Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I have an unusual video here that I would like to pass on to you. A gentleman has written back a reply and seems to understand the problem that I've been trying to show for years, and people have a hard time understanding what actually causes this. And I'm going to give you this video, and I mean the reply the guy writes, and basically in here he says he has the trouble with his bite. In other words, he bites now on his front teeth, and when anybody does and you have an overjet and overbite, you go out here and bite with your front teeth. You don't want your back teeth to hit at all, or you can't cut through the thing properly. And when you do, you move your jaw forward, and the condyle back in the back moves out of the fossa, and the disc is on the condyle, and you press back here with more force than you have up here. You don't go out on your front teeth and bite as hard. You don't crack a nut with the front teeth, or you do, you're risking damaging the disc back here. And what's happened, he has been forced to bring his jaw out here to keep it from hurting, and he bites there and it hurts even worse. Now the force back in the back is right, the condyle in the fossa and the disc in between there is right by the muscles. The muscles pull the jaw too. So if you bite with 10 pounds of force out here, you may have 25 or 30 pounds of force back here on the condyle coming up against the disc. Now the disc we have back in there has no nerve endings in it, and it has no blood vessels. It is fed by the synovial fluid from the retrodiscal tissue, which is a highly vascular set of tissues there. And when you bite down, it squeezes this synovial fluid out, and that feeds the disc as well as lubricating it. And so when you do too much chewing out here, you'll get this irritated and inflamed, and you just have to keep eating and pressing on it, and when you do, it gets sore as the dickens, and that will distribute this pain all over your head. Your people come in with necks, shoulders, and headaches and sinus aches. Everything you can think about will be aching. And what you have to do to stop it is put some load back here on the teeth, so that when you bite with your front teeth, if that's the only place you can bite, then you put a block on the posterior teeth back here, and you have it come in and take the load, and that puts the force back up into the bone structure here rather than into the disc, and then let this heal up, and that's the way you do it. Then you put the block on the back teeth and let the other teeth come together. When they get to where they take the load, you can take the block off or grind it off gradually and let them erupt together. So read over what this gentleman has said, and here he wanted to spread this out into far and wide, let people understand that he'd had a lot of problems with it. And this is the answer to this reply here, that if he wants to get relief back in here, put a little bonded block on the posterior teeth, and then when you bite, the load will go up through the bone instead of into the disc, and let the disc heal up if it gets inflamed. Uh, I'm, I'm going to have to pause here and clear my throat out a little bit. Back again. I've been trying to explain this on retention. It's involved too. If we take a deep bite case and open it up, and then I put a bite plate in there and have the person meet, and we make a retainer with a bite plate, and if that person loses a retainer, or they go and leave it at grandmother's or something and leave it out for a week or two, the teeth will deepen again. In other words, your lower teeth will go back up underneath here further. Now you find the retainer and you put it back in the mouth. I tell them you've got to wear it now and kind of force wear it. But when I bite down, I hit the bite plate and no teeth touch back here, and they'll come down with pain or discomfort, and they automatically think the retainer is warped or it's messed up. Have the people come back in and everything else, and there's nothing in the world except their teeth have gone back up where they had the deep bite. They opened it up, they left the retainer out, the teeth closed down. Now they bite and it hits in the front on the retainer, and nothing touches back here, but the condyle is up against the disc, and it'll irritate the disc, and it'll get to hurting, and they blame it on the retainer having warped, but it doesn't. So they have to come back in, and we put the retainer in, and we put some little blocks in the back, bond them to the teeth, and that takes it and let the other teeth erupt together to where they take the load. Then you can take the block off the back normally and get them back where they were. Now that is hard to get across to people who have these deep bites. And when you put the retainer, if you leave it out for just 2 or 3 days and it deepens some, you'll feel that some, but it'll go back together without getting inflamed. So I hope that this is understood, and I hope this gentleman that is written here will understand, and I hope that he will help me spread this far and wide so that people understand when you bite with your front teeth, there's nothing touches back here except the condyle up against the disc, and the disc is in the fossa in a forward position, but you put lots of force on this, and that you don't bite hard with your front teeth unless it's a life or death situation, and you have to chew easy and then bite back on your teeth, and if you're biting your teeth together, the load goes up through the bone structure and you don't have this pain. So I want to thank this gentleman, and I hope you'll read his comment here, and maybe people will understand this a little better. But I've had such a difficult time getting people to understand that where you retain a deep bite case with a retainer and they leave it out and they blame it on that, it's the same problem that this gentleman's having. So thank you for watching, and I'm going to sign out, and I hope you'll get something from this. And if you learn it like this gentleman has, help me spread this far and wide. So I am very grateful for him for having written back. This is, I believe, the first person that's ever written back and seems to understand what actually is causing this trouble. So I'm going to sign up and sign off, and I hope you'll get something from this, and if you do, try to spread it far and wide for me. Thank you. Now I'm going to close out.